Good morning, everyone, and welcome to the October meeting of the Kansas Early Childhood Recommendations Panel. My name is Cornelia Stevens. I'm Executive Director of Top Early Learning Centers, and I have the honor and privilege of serving as the chair of the committee. I would like to thank all of you on the panel for serving Kansas children, their families, and our state's early childhood care and education professionals. This is a remote meeting, so today's meeting materials are posted on the panel meetings webpage at kschildrenscabinet.org. Panel members, we ask you to please clearly identify yourselves before you begin speaking, and you can use the raised hand feature to show that you're ready to share, just so that Lindsay and I make sure that we get anybody's input that wants to have comment or questions. For today's agenda, we will be approving the September agenda. We'll be approving the August meeting minutes. We don't have anybody today for the Kansas Open Forum, but I'll talk a little bit about that. So if we have anybody watching that's interested in sending any information, then we'll give you instructions for that. We'll have an update from the Kansas Interagency Coordinating Council, the Preschool Development Birth to 5 Renewal Grant. Work groups will then give a report of anything that they discussed last month. And then panel members, you'll have the opportunity to talk about bright spots and anything wonderful that's happening within your community or your organization or across the state that you might be aware of that you might want to share. Upcoming meeting dates will be reviewed, and then we will adjourn. And Lindsay, thank you for approving the September minutes instead of the previous, so thank you. So to get started first, we are going to approve the October agenda. So the October agenda was sent out to panel members in advance. If we've had no changes to the agenda, may I have a motion to approve the October agenda?
This is Natalie McLean. I'll make a motion to approve the agenda.
Perfect. May I have a second?
This is Amber Wheeler. I second.
Perfect. All those in favor say aye or thumbs up.
Aye.
Aye.
Any opposed, same sign. All right, thank you. Motion approved. So the September minutes were also sent out in advance. We've all hopefully had an opportunity to review the September minutes. If we've had no changes or modifications to the September agenda minutes, may I have a motion to approve the September minutes as presented?
This is Tanya Kane. I approve the September minutes.
Perfect. May I have a second?
This is Amber Wheeler. I'll second.
Perfect. All those in favor, thumbs up. Any opposed, same sign. Perfect. So as I mentioned, we do not have anybody presenting today for the Kansas Open Forum, but for those who might be watching the live stream, we encourage Kansans to submit comments or questions, anything that they have that they want to share with the panel that you think might be interesting for us to consider, information that you'd like us to know, anything like that. We definitely love to be able to hear from you. Any of your comments can be submitted through the Kansas Open Forum comment form, which is on the Children's Cabinet website, kschildrenscabinet.org, by 5 p.m. the day preceding each meeting. And we'll give you an opportunity to share written comments or sign up to share verbal comments to the panel during this portion of the meeting. So again, we don't have anybody today, but if you have any interest in sharing information, we'd love to hear from you. The first presenter for today's meeting will be Stacy Clark, and she's going to give an update on the State Interagency Coordinating Council.
Good morning. Thanks for having me. And I see lots of friendly faces, so that's always good when you see people. So I'll be going over a lot of things some of you will already be quite familiar with, but I was asked to not only review what the SICC has done based on the recommendations of the All In for Kansas Kids, but also to talk a little bit about the SICC and the LICC and kind of give an overview of what they are. So next slide. So the SICC, also known as Kansas Coordinating Council on Early Childhood Developmental Services, because if it's not confusing enough to have a lot of acronyms, we also have multiple names. So the mission is to ensure that a comprehensive service delivery system of integrated services is available in Kansas to all children with or at risk of developmental delays from birth through age 5 and their families. And I will add that not all states choose to include children who are at risk for developmental delays. So that is something amazing that Kansas does do. And then below is the state statute and federal regulations that create what we refer to as the SICC. And also there's a link to our website. Next slide. So like I've already said, we have a lot of different names. In Kansas, we're mostly known as the SICC. Sometimes you'll see it written out, Kansas ICC. And then very rarely, but once in a while, you'll come across the Kansas Coordinating Council on Early Childhood Developmental Services. So like I said, if it's not confusing enough, we have multiple names. So the SICC, we have an MOA. We're funded and supported with an MOA between KDHE, KSDE, and DCF. They all contribute funds into the SICC fund account. And then the MOA also outlines the work that the SICC will do in collaboration with the different programs. And again, there is our link to our website if you want to learn more about us. Next slide. So then there are also local interagency coordinating councils, also sometimes called LICCs, but they also come in a variety of different names. They are a requirement of the infant toddler Part C programs, and they're comprised of community members that have an invested interest in interagency system of service provision for children aged birth to 5 and their families. And basically that's just a fancy way to say that anybody in your community who has services that support families, support children, are usually interested in belonging to the LICC. Some LICCs have representatives from the health department, from healthy families. Of course, there's always quite a few Part C representatives on there. Parents as teachers will usually belong. There's some that also have representation from like a local pediatric clinic or other health professional. A lot of times, or not a lot of times, but sometimes I've seen charities belong to the LICC. So a wide variety of people all come together at least quarterly to talk about what are the needs of the children in their community. And while the purpose of the LICC is focusing on children with special needs, they're really there to offer services to families to support all children in their community. And again, this is a regulation that Kansas does. This is different than most states operate their Part C programs through an LICC, but I think it works really well in the state of Kansas. So next slide. So there are 29 local interagency coordinating councils, and I have a map here. And so let's see. Go ahead and put in the chat if you have access to that, like which number of local interagency coordinating council represents the area that you are in. Yeah, good. We've got quite a variety. This is nice. Yeah, and like I said, they come by various different names. Sometimes people will be on the LICC and won't even know that that's what it is because it has a different name, but they know, yeah, we get together and do things. Sometimes an LICC will also serve as the advisory council for multiple groups. Like I know some parents as teachers advisory councils are also, they use the LICC for that purpose. So since they're all in the same meetings discussing the same things, that's often the case. So next slide. So the LICC's official role is to advise and assist in things like child find activities, communication and collaboration among community partners on issues pertinent to young children and their families. They also help with public awareness. Sometimes they'll work together for professional development, or they'll learn that they need to have more professional development for childcare providers, service providers, just a general awareness in their community, and could do some joint professional development. They're also responsible for advising the lead agency with matters of policy and resource development. So the Part C program, sometimes people don't realize that the LICC is kind of goes with the next bullet here. They're supposed to be supporting the Part C program and identifying a lead agency, and also the physical agent, and also kind of helping serve as a conduit for communication sometimes when there could be a little difficulty between the two programs, and so they can help support with that too. And then finally, they should also be reviewing and approving the local Part C program grant that needs to be submitted every year so that they can get their funds for operating the Part C program. So any of this surprising to any of you, that these might be some things you didn't quite realize that LICCs do? I know sometimes even when I give a presentation to LICCs, they're like, oh, wow, we didn't know we were doing all those things. So, okay, next slide. All right, so we're going to jump into, these are the recommendations from the Kansas Children's Cabinet for the SICC and the LICC. And so this kind of, you're going to have to forgive my slides. They just have a lot of typing on them today. I really struggled with how to structure this, but I wanted to give you an overview of these were the recommendations, and then we'll kind of go through each one and we'll talk about what the SICC has done. So broaden local ICC participation and membership through strategies such as holding meetings outside of normal hours, provide stipends for travel, childcare, and just for the council members' time, research funding opportunities to provide those stipends to early childhood care and education professionals and family members for their time not only on the SICC but the LICC. Promote communications of LICCs to create awareness of community resources and share them through communities to address the needs of children and families with developmental delays, disabilities, or special healthcare needs. Sponsor community engagement events, provide informational material, and identify how can these events and resources be networking opportunities while informing their community partners about the challenges of families and professionals that they're working with, and addressing the needs of children with developmental delays, disabilities, and/or special healthcare needs. And then the final one is propose monies to include in the state ICC budget to fund community projects proposed by LICCs to support the All In for Kansas Kids Strategic Plan Goal 2, which I believe was community involvement. So okay, so now we'll look at each one and we'll kind of talk about what the SICC has done in regards to them. So next slide, please. And the next one, I actually have two of them listed. So I grouped these two together because I thought they were related, and our actions were the same for both of them. So we're really trying to increase local LICC participation and membership. And some of the LICCs have explored the idea of meeting outside of normal business hours, but for the majority of the people who attend the LICC, that wasn't going to be functional for them. So it was discussed among some LICCs, and they decided that just wouldn't work for the majority. But one of the good things that have come out of COVID is we've all gotten really good at having virtual meetings. So that allows some people to attend in person and some people to attend virtually. And nearly every LICC that I attend or that they have, there's that option. You can attend in person, and then they also do a really nice job of including the people who are attending virtually. So also to provide stipends for the time, and then to provide stipends to early childhood care and education professionals who for spending time serving on the SICC and the LICC. So those were the two goals. So we'll talk about what we've been doing. So next slide. So we have offered grants of up to $2,000 to the LICCs to pay for, there's kind of a list of things that we allow. Family members' participation, and that includes the mileage, if they have childcare expenses, and also can offer some stipends. And a few of them have also offered, like they can't really, they're having a hard time getting families or family members to commit to coming to a meeting that's reoccurring, could be every other month, it could be quarterly. So a couple are starting to think outside the box and are having more community engagement events where they're just bringing families together and, getting some feedback from them, asking them what's going well, what they'd like to see improved, asking about their specific experiences. And so the funding has covered some of that. So we had 3 LICCs that received funds to specifically do that. And there were 2 parent cafes. Those are the smaller events where parents come and provide their feedback. We're given some stipends for. I will say we had some really interesting ways that LICCs tried to use their money to engage with families. And one of them was they had invited some family members to attend LICCs, but they didn't want to travel the distance. And they said, well, how about if you join us virtually? And the family didn't have access to reliable internet. So the LICC said, no problem. We're going to apply for this grant and get you some hotspots. And that way you would be able to attend our LICCs. They're trying to break down all barriers. And unfortunately, then when they did offer that, they weren't able to identify any families who actually wanted to take advantage of that. But I thought that was a great way to really be thinking about how do we get this family voice in our LICCs. So another thing that we've done is the SICC does cover the cost for members to attend in-person meetings for their meetings, SICC, and for childcare. We don't have very many in-person meetings anymore. We just typically have one a year. And unfortunately, it seems like the last couple of years they've been snowed out. But we do offer that. And then beginning just last month, this is something new, as family members are also going to be reimbursed at $20 an hour for attending SICC meetings, whether they're virtual or in person. And then LACC membership has broadened. KU CPPR has done some research into what LICCs used to look like and what they look like now. Actually, this data is probably a little over a year old now, but the average LACC size in 2019 was 18 members, and it's currently about 25 members. And I would say most of them have a good 20 people at least that consistently attending their meetings. It's always nice when I join virtually and I look around, and when I get on, they're scrambling around to try to find some more chairs or tables or something. I always think that's great. They've also increased their community service agency, higher education, school district, and local business representation. So that was something I hadn't mentioned earlier, is that more businesses are attending. Some of the LICCs have a focus of really trying to improve the childcare or family-friendly workplace, and really being able to partner with local businesses in their community to really talk about how can we be supporting families, because this all leads to a healthier community. And then there's also the collaboration among members remains high, even though the communication has decreased somewhat. So again, this was a survey done by the staff at KU through the CPPR program, and this was information that they were able to bring back to the SICC. So, okay, I know I've been talking a lot about this and saying lots of different things. Does anyone have any questions so far? No? Okay, we'll go on to the next goal then. So this one was promote communication of LICC members to create awareness of community resources and share them throughout their communities to address the needs of children, families with children and families with developmental delays, disabilities, and or special health care needs. So we talked a lot about needing to update our website. We actually have a new website now. And when we were talking about all the resources to list on our SICC website, we realized that yes, I could go in and enter all of the resources we have throughout Kansas. And then in a month or two, it would be outdated. Things would need to be updated. So the practicality of keeping it updated just wasn't probably going to be feasible. So we decided as SICC to partner more with 1-800-Children. And so we have been promoting 1-800-Children. We have made sure that they have all the resources that we had on our SICC website. Another thing is the 1-800-Children now has an early childhood tab on it that it did not have before. And when somebody searches for resources for infant toddler development, now the Part C programs are the first resource that pops up. So, and we've been encouraged, I believe all infant toddler programs have updated their contact information, and updated the zip codes, because it's important that anybody who has their program listed on 1-800-Children, you need to list every zip code that you cover, because that's how people find the resources, is through the zip code that they live in. And yeah, so we've been pretty proud about that. I tried to spread the word about 1-800-Children to all the meetings I go to, especially when I hear LICCs are getting ready to do a community engagement event or a child development event. I'm like, have you ordered the 1-800 magnets? They're free. Here's how you get them. SICC has also promoted inviting diverse groups to the LICCs. And so when I say diverse groups, I just mean thinking outside the box. What charitable organizations do you have in your community who offer services to families that you could partner with? It's always good to hear what's going on in your community. So really thinking about who should we have at the table here with us. And funding the LICC grants have also funded community awareness events and provided promotional materials for LICCs. There have been some great, wonderful things happening where families just come together and learn about all the services in their community and just have fun together using the funds from the grants. And for the last 3 years, we're getting ready to do our fourth one. The LICC has had they call it the fall retreat, but it really is just a professional development opportunity that's free to anybody at all who works or cares about early childhood or children birth to 5. And we listen to what we hear from across the state about what are some needs, and then we tailor it by inviting presenters to come and do professional development. And then they also have time to collaborate about what they've learned in the professional development. And we like to give an update on just the state of early childhood across Kansas when we do the LICC retreats. So I'll plug that if anybody's interested. There's one coming up on November 1st, and you can register for that through TASN. So the next slide, please. So the next goal was for us to sponsor community engagement events, which I've already kind of started talking about, provide informational materials, and identify how these events and resources can be networking opportunities while informing their community partners about the challenges of families and professionals in working with and addressing the needs of children with developmental delays, disabilities, and special health care needs. So the SICC sponsors the Kansas Division of Early Childhood Conference that brings together lots of people to learn more about the needs of early childhood. And Also invites parents and caregivers to come, so their voice is also heard there. The SICC's provided 12 LICC grants that were specifically for supporting community engagement events, and several LICCs were able to hold 2 community engagement events with the funds that were provided to them. And 2 LICCs in Southwest Kansas worked together, which would cover about 26 counties. And they used their money to fund a 2-day professional development event for parents, providers, childcare providers, anybody interested in attending that. So brought in somebody that's very well known and well respected in the area to do some professional development. Okay, next slide. So another goal, propose monies be included in the state ICC budget to fund community projects proposed by the LICCs to support the All In for Kansas Kids, which is a community level engagement. Again, I've been talking about them. We've done the LICC grants. They were offered to all LICCs, and it wasn't a competitive grant at all. If you had a plan in place to support parent involvement, provide professional development for service providers and others, promote community awareness, promote child development events, you were granted the money. And also to work on bringing in diverse members of people, thinking outside the box to grow the number of people who attend your LICC. Referrals have increased to the infant toddler program. Oh, and I was going to get that number for you guys, and I actually forgot that I was going to do that. But the number of children being referred to infant toddler services has increased. And then as I was reviewing the goal 2 of the Kansas Kids Strategic, All In for Kansas Kids Strategic Plan, I noticed that one of the measures that was going to be used to look at and see if this goal was being met was the ASQ developmental screener. And so if you'll go to the next slide, it shows over the previous several years the increase in the use of children screened with the ASQ. So of course, we're still in 2024, so we don't have the final numbers, but I did run a report, and so far in 2024, the number of screenings. So this isn't quite the same comparison because the graph you're looking at is the number of children screened. But so far in 2024, 105,749 ASQ screenings have been given that were entered into the KSDE ASQ account. So I do know that there are still some communities who do the ASQ on paper, but each year the number is growing. And so that's always important that we're reaching more families and their children are getting screened for developmental delays. Okay, next slide. So this is a breakdown of the grants that were awarded through the LICC to, no, through the SICC to the LICCs. And I also included the number of counties that would be. So there were 53 counties impacted. We were able to grant $33,931.50 to LICCs. And it kind of gives you an overview of what the LICCs chose to use their money on. And the next slide. So overall, what has SICC been doing? We gave out the grants. LICCs have been increasing in size and in diversity since the recommendations came out. And we've also took action to increase family engagement in LICCs. So, and like I mentioned before, not all of them have been as successful as we want them to be. And so we're starting to make a shift towards finding ways to engage families without them making the commitment to attend LICC meetings or SICC meetings. So that's something we have to look forward to. And the next slide. So moving forward, we are going to be offering the LICC grants. I'm just negotiating with KSDE on the language of those grants. If you've ever tried to do grants through a state agency, it's not an easy process. So we're about to release those. But I have informed the LICCs to start thinking about it because they're coming. We're hoping to improve meaningful engagement with family members on the SICC and LICC, which I think I've talked a little bit about, and increasing the effectiveness of LICCs. Sometimes I'll have people ask me, well, I don't really see the purpose of it. It's like we just meet and we talk, or we don't have very many people attend our LICC. So we're really wanting to empower the LICCs by giving them the knowledge of what their role is and what they could be doing for their community. And then also we're still going to be supporting an increase in developmental screeners, which basically is the ASQ in Kansas. So, and the ASQ will be, we got approval from the Kansas State Board of Education to extend our grant with the ASQ, Brooks Publishing, who is the owner of the ASQ, through year 2028. So that will be continuing. Okay, next slide. Okay, so yeah, I was also asked to just share a little bit about the SICC, and we had strategic planning in September, I think it was, and kind of did some reorganizing of our committees so that we could be more efficient. And this is the goals that actually we're going to vote on later today, as these are our official goals. So these are the ones that'll be they're tentative until later this afternoon. Maximize Medicaid reimbursement for Part C and B in the B619 programs. And then the next one's also maximize categorical aid and reimbursement for Part C programs. So really, this goes back to, as we are discussing Part C programs, infant toddler programs, there is a workforce shortage. There's a retention in the workforce shortage. And we were really trying to evaluate, why is that? What can we do to support that? And a lot of it kept coming back to a money issue. They're maybe not making a livable wage, or they're not being paid as well as they would be if they were working in a different setting. And so we were brainstorming, well, how do we support this better? And really, it's making sure that programs are accessing the Medicaid reimbursement that they should be, and also the categorical aid reimbursement that they're due. So that's something that we're going to be working on, hoping that if programs have more money, that they'll be able to pay a more competitive wage, and also take some of the stress off of staff from being short-staffed, and be able to do more with retention. The next goal is increase inclusion practices for preschool age children. We know that all children do best when they are in inclusive settings, both typically developing children and children with special needs. So really working on that and helping preschools do that. And we have discovered there are some preschools that are doing it, but they're not coding it correctly in the KSDE system. So also working on things like that. And then the next goal is assure alignment with the All In for Kansas Kids strategic plan. And so under that, we're going to be focusing on improving the availability of reliable resources and information for parents in a centralized location, AKA 1-800-CHILDREN. Improve the availability of mental health resources for providers and caregivers, because we know if our providers and caregivers have the social emotional skills to manage their own emotions and interactions with others, that will lead to success for children also. And improve the recruitment and retention of the local workforce by collaborating with others. And we haven't started digging into that one yet, but we have been promoting Educate Kansas, as it is a free service for any. So we've been communicating with them about is this just for schools? And they said, no, it's for, it could be used in infant toddler programs too. So, and there have been some that have reached out, and I think if you live in the Wichita and Kansas City area, there should be some big billboards promoting early childhood workforce jobs. And so I know that we'll continue to do things like that. And then another one hasn't been decided on yet, of course, but thinking that we'll be continuing the networking and professional development opportunities offered by hosting the fall LACC retreats. We've been really excited. Last year, there were over 100 people who attended. It was just great to hear the good conversations in our small breakout groups about what they were learning and what their experiences were across the state. And next slide. All right, that was it. So, I feel like I was just giving all kinds of information for the last 10 or 15 minutes. So, what questions do you have? Any clarifications? Any things you're thinking about?
Um, this is Stephanie Waterman. I'm the early childhood program coordinator in Geary County. Um, and I just wondered, have you guys, with that goal of increasing inclusive practices for preschool age children, has there been any discussion? One practice that I'm seeing become more common, especially when I get IEPs from larger school districts, is for children that are found eligible for services when they transition from Part C to Part B, but their birthday falls after August 31st, that more and more the service model is by appointment because of the funding aspect, of not receiving funding for that child because they weren't 3 by the state birthday, cutoff date. I just wondered if there's any discussion of looking at that, or who even, we would need to be on board for that policy change to make sure that services are determined not based off of like the funding, but rather what would be more inclusive.
So services should not be based on funding. There
Right.
should always be a continuum of services offered to children. And children who do turn 3 after it's August 31st, right? I think, yeah. They may not get all of the funding, but there is still some funding through, I got to think about this for a minute. Through, like transportation, and there are some funding that comes. I know they don't get as much funding, but also districts should be planning ahead. They know 3 months or more in advance what children are coming from the Part C program that will be turning 3. And that may mean that they start the school year maybe with a few empty slots, knowing that 3-year-olds are going to be coming and are going to be best served in classroom settings. If it ever comes to our attention here at KSDE that somebody is saying we do appointment only for children who turn 3, it is always something that we address immediately, and we have been doing that. We need to find a placement for these children, and often it's not a surprise that they're showing up. Like I said, they've been in the Part C program. They would be best served in a preschool setting for the services that they qualify for, and that's where they need to be.
No, I completely agree with you. And I would say it's more prevalent when we have an out-of-state IEP that comes in, and the eligibility report, and then the services that the child was being provided don't quite make sense. And then you call and they say, oh, it's because of when they turn 3 that this is what we provide. But and I'm not, like throwing anybody under the bus, I hope, but I have seen a couple in state from that that also the children begin with that by appointment model. And so it's just concerning.
Yeah, and we
Lots of
have been
reasons.
we have been
Sorry.
addressing it more and more, and it is on our radar that that's the funding issue needs to be addressed.
This is Amber Wheeler. There are lots of reasons why a student might be on an appointment only setting that have nothing to do with funding or slots. Sometimes that truly is the best option for a student to be served, particularly if they are already in a local preschool and things are going well. The best option for that kid sometimes is not to upset the apple cart, but to let them to continue to be successful in their current environment and provide services for them as well. Empty slots is an interesting comment because we don't have empty slots. If for us to have empty slots, we turn away kids, and that's not okay for any kid. We're not sitting with empty slots just in case. A lot of times we're making slots when those kids come available just because we need a slot. But there are lots of reasons that a student might be on appointment only that do not have anything to do with funding or slots being available, but truly is what's in the best interest of that child or what that parent is interested in at that point in time in making that transition from home to school.
Yeah,
No,
absolutely.
I'm sorry.
Right.
I wasn't inferring that that's the only reason. Just that, has been a bit of a concern. We have so many kiddos that turn 3 after that August 31st date. So, but yeah, the first are
Yeah,
making
and
that decision based off need.
Yeah, and I apologize if I use that terminology also, slots available. Because yeah, we always make room. And you're exactly right. We have some families who aren't ready for their child to go to a preschool setting yet. And like she said, they're in a community setting and they're best served by either getting their services in their community preschool setting or daycare setting or appointment only. Kelly?
I was just thinking that this is such a great example of when an LICC could be helpful in kind of that systems issue by having your Part C and Part B partners along with community early childhood educators together to sort of discuss this is like, that's a great opportunity within the local LICC. But Stacey, my question is, if an LICC were to run into this and need more brainstorming or support in how this could work better, is there a mechanism for issues within an LICC to be brought forward to the state ICC?
Yes. Oftentimes it'll come either to me or through your I can't remember what you call your kits person that supports the Part C program. But yeah, it'll come and we'll all work together as a team with the LACC, Part B program, Part C program, to just talk about what are the needs of the Part C program? What are the needs of the Part B program? And how can we all work together to make this smooth and efficient and make sure that parents also understand the process and what's happening and how the services are different. And yeah, we have some things in place tools in place that we use when we do that.
Very good. Any other questions? If none, Stacy, thank you so much for that overview of everything that's happening across the state and sharing information in terms of your goals for 24-25. Lots of good info, so thank you very much.
Yeah, thanks for having me.
Of course. Next, we will have Megan Kluth, who is going to talk about the preschool development birth to 5 renewal grant.
Good morning, everyone. Thanks for having me. As Cornelia said, I'm Megan Kluth. I'm a research project manager with the Center for Public Partnerships and research at KU. And I am very excited to give you a quick overview of a new grant that is coming into Kansas. So Kansas on September, last day of September or first day of October was awarded a new preschool development grant. It was a very competitive grant application for those who, I know many of you are probably very familiar with preschool development funding, or PDG as we call it. For anyone who is not, this is the fourth time Kansas is getting some type of funding. It is federal funding through the Administration for Children and Families, and it's a great grant because it's very focused on early childhood systems building. And so we've had some variety of these funds since 2020, and it's really, I think there's a broad amount of activities that have been able to be covered through this because it is so focused on systems building and all the different services across the early childhood and mixed delivery systems. So this was a particularly competitive application. I think about 25 to 30 states were eligible to apply, and Kansas is one of 10 states awarded. So I want to note that because that's a big deal for us to be selected. And I think it is just a reflection on the great work that has been happening across the early childhood system for the past several years, including the work that all of you are doing. And I think this new grant will be just a very nice addition to keep building on that foundation that's been laid over the past several years. So the Children's Cabinet and Trust Fund is the grantee. With approximately $7 million per year. It's a 3-year grant. It is like all federal grants, pending congressional approval each year, but it should run from this September through September 2027. And as I said, this is our 4th PDG award, so we are very excited to be a part of it yet again. And then, as I noted, it is because it's focused on early childhood systems. We really make sure that everything in our grant is guided by the All In for Kansas Kids strategic plan, so that all of these pieces are fitting together, and that there's really nothing in the application that feels totally new. I think it's very much building on the vision that's been laid out in both the new strategic plan and as well as the previous strategic plan and needs assessments. Next slide, please. So I'm going to, in a minute, give you an overview of the activities, but I first want to just share kind of why the activities were written the way they were. There are set categories that were required for the application, and this very much mirrors previous applications and kind of the direction from the federal government that they want states to go, as well as having some new focus areas. So the first 2 activities have been pretty consistent throughout these PDG grants. Looking at the statewide needs assessment, statewide strategic plan, we have recently updated both of those. And so it's just making sure we're continuing to do so, and as well as using them and implementing the strategic plan. And then family participation, engagement, navigation, all of the above, as well as workforce engagement those are consistently big focus areas for the grant. So there's quite a few activities focused on that, as well as quality improvements, and then sub-grants. And then the next slide shows strengthening early childhood systems. That is actually what we're doing here today. That is our governance groups, that's aligned communications, just making sure that our systems are working nicely together. And then the 2 areas that were a little bit new, and you'll see this reflected in the activities in a minute, is they had 2 optional activities. One was really looking at increased workforce pay and benefits. Obviously, that is a big issue in Kansas as well as across the country. And then supporting social emotional development and mental health. And this was very open to supports for young children, for their caregivers, as well as for the early childhood workforce. And so we certainly see that as a critical need in Kansas, and you will see that reflected in the activities that are funded. Next slide. Okay, so I'm going to go through a very high level overview. It's a big grant. It's 3 years. There's 29 different initiatives. So this is very much a quick summary. And our hope is that we can stay engaged with you throughout the process so you can kind of follow along. And if you see connections to your work, both in your role on the panel as well as in your other roles, we would love to know that. So the first one is strengthening all and for Kansas kids system level knowledge, collaboration, and communication. So as we know, we updated the needs assessment earlier this year. And so to dig into that further, we're going to do 3 gap analyses that we feel like we know there are gaps here, but we need to know more to have good localized solutions. The first is rural family care. Like we of course know that rural family experiences are just different than urban family experiences, but what does that look like? What is it like if we break that down, what does that actually mean? And what does that mean in different parts of the state as well? We don't want to kind of paint too broad a picture of what rural experience in Kansas looks like. We'll also do a gap analysis on family childcare specifically and understanding like what's working really well for family childcare providers and where are there gaps and needs for further supports. And then the last one, again, tying to the focus area of the grant, is early childhood mental health. What's working well? Where are there gaps? What does that look like across the state? So over the course of 3 years, we will complete those gap analyses and then use those to help inform kind of next steps for each of those areas. We'll also be implementing the strategic plan and then looking at where are there quality indicators. We want to make sure we're understanding, particularly engaging families in this, of like what does quality mean to families and how is that showing up in the strategic plan. So more to come on what that's going to look like, but we certainly want to make sure that we are showing progress on the strategic plan and also kind of stopping to reflect along the way and making sure it still feels like we're heading in the right direction and that it feels really reflective of families and communities' needs across the state. We'll continue developing the All In for Kansas Kids site that was recently relaunched. If you haven't seen it, it's very pretty. But that is a site for a lot of different system level information. So we'll be continuing to build that out. Similarly, we'll continue to build out the eSIDS dashboard. So that's the distinct count of children dashboard that was launched recently. And then lastly, in this area, if you're familiar, the Future Fellows is a program that has brought in leaders from different sectors across Kansas to really imagine like what the future in their kind of world that they work in could look like and how to get there. And so we're going to do the cohorts again, but bring in early childhood leaders so that maybe state agency staff, community-based organizations, people at the local level to really focus on what does whatever your role is, like what kind of future do you want to build for early childhood in your community and how do we think about actionable solutions and how to like make positive change. So we're really excited to be hosting those. So those will start later this first grant year. Early childhood workforce initiatives. So I'm actually really excited because we have one of our partners on the panel. We have several organizations, including CAME, that will be doing a lot of work to increase access to what we're calling like specialized care, as well as mental health. So we recognize that there's just, I think, a need for, of course, mental health trainings and support for the workforce, as well as different types of more focused training to help early childhood professionals feel equipped to support families and whatever needs that they have. So actually the conversation you all were just having about that transition from Part C to Part B is very timely because one of the trainings that we'll be looking at is how do we increase collaboration among Part C providers and childcare professionals and families so that everybody is feeling connected and we're really supporting children as they're moving through different services. So we'll have some mental health focused, we'll have some special healthcare needs focused training, but really trying to help families feel like the providers for different services that they're utilizing are meeting their kids where they are and the unique needs that they have, and that the professionals feel like well supported and equipped to provide quality care to those children. We'll also be expanding a childcare substitute care model that was scaled through the Childcare Capacity Accelerator. So working to make sure that childcare professionals are able to take time away to go do those professional development opportunities or take personal days off, and that doesn't mean that care isn't able to continue. We will be making further enhancements to the new CAPE portal, which is Kansas's new workforce registry. We'll also be scaling a model that was developed in one of the previous PDG grants for health insurance stipends, and as well as navigation support for childcare professionals interested in learning more about the healthcare exchange, so that they can understand what insurance options might be available to them. And then we will be expanding Childcare Aware's Kansas's Baby Steps model, which is an infant toddler incentive model. And we'll be really focusing on that in rural communities to make sure that for communities that there literally are no infant toddler slots, so that we can try to help address some of those gaps. Family resources and navigation, of course, is a big element of this grant. You'll notice the first word of the slide is exploration, because I think we're still figuring out what this looks like, but we want to explore some online tools that can help families navigate across the mixed delivery system. So looking at what are other states doing. So we've seen several other states using AI, which is, I think, admittedly feels a little scary, but I think we want to see, is that a beneficial tool to help families just be able to get the right information and the right amount of information they need at a time, at that time. And then also looking at streamlined enrollment. So where are there opportunities to just ease navigation and limit the number of times families are needing to complete certain information, as well as professionals supporting them. So we're still figuring out what this might look like, but again, it's really early exploration of, are there tools just that we can build on what's working well within the system to just make it a little bit easier for people to find information. Expansion of family access to the ASQ trainings, screenings. So we know that has been a big focus area for the state over the past several years, and we want to build on that, as well as making sure that the resources and the materials that we're sharing are really family friendly, so that families understand what the results are and understand what next steps might be in place if their child is identified as needing a little more support. We'll also be reaching out to make sure that the ASQ is really being utilized across, like with healthcare practitioners or throughout the state, universal home visitors, as well as the maternal child health system, so that we're covering as many places where families may be interacting with the system as possible. And then lastly, for this section, we want to make sure that language and just cultural needs are not a barrier for any family to access services. And so we're doing reimbursement for translation and interpretation services, which this could be for families as well as professionals supporting families. So if somebody's going to like a doctor's appointment and language is a barrier, our hope is that this can be one way to help remove that, or at least reduce that barrier. And then state, local partnerships and community collaborations. So we are going to be doing a pilot of what we call a childcare zones. These are going to be grants that are really from the state level to local communities to support locally driven solutions to childcare. And this idea came from lessons learned from the Childcare Capacity Accelerator and other state level grant opportunities, as well as some of the aid to local partnership models that have been in place for a while with with the state. So more to come on this, but we're excited to be building that out in the next few months. And then business roundtables to strengthen public-private partnerships. We learned a lot through the Childcare Capacity Accelerator about kind of approaches to public-private partnerships. And this is a chance to actually meet with business leaders throughout the state to understand, like, what does a public-private partnership mean to them when it comes to early childhood? What are the barriers potentially for them participating in that? What are the opportunities? So it's really, I mean, it's what it sounds like. It's conversations with businesses to try to figure out where is their common ground and how can we work together to I think meet shared needs related to early childhood. And then consulting to help communities build local level referral practices. So this is really, it's pretty broad in terms of what this could look like. But going in at the local level, which could mean a lot of different things. So maybe it's a local community, maybe it's kind of a local like network of providers or professionals. and helping them understand, like, what does your information sharing process look like? Is there a need for a referral? This could be a tool, process, practice. So just trying to help improve information sharing at the local level, as well as kind of assessing, like, our communities, like what needs to be in place for communities to be ready to have those types of conversations. And then lastly, we are going to host what we're calling regional early childhood care conferences. And this is really a chance throughout the state to bring families and professionals and really anybody from the public who's interested in early childhood together. The focus will be, there will be a strong emphasis on mental health and what that means, both for taking care of the mental health of young children, but also for anybody who has a young child in their life, for caregivers, for the workforce. And then there will be some additional training opportunities so that people, it'll be leaning on that kind of specialized care training approach, so that both families and professionals can find what kind of gap they have that they want to address through some training and education. So we're very excited to bring all of those people together, and also, I think, hopefully just build a little bit of connection among the region so that people can meet fellow providers in their area, fellow families. And we know that, like, isolation can be a challenge for both groups, and just with the first PDG, we got it in the height of the pandemic, and so the idea of being able to actually bring people together in person is very exciting, and something we want to take advantage of over the next 3 years. Next slide. I know that was a lot of information, and we are all of 3 weeks into this, so there's a lot more to come. We will be sharing the executive summary, which is essentially what I just shared, but it's a nice little 2-page document. Lindsay can send that out after this meeting. And then I just invite you to kind of follow along with us. We will be sharing updates as we go in the All In for Kansas Kids newsletter, the webinars, as well as the website. And I certainly can take questions here, but I also just want to create like a standing invitation. If you see some sort of connection with your role with the panel or your other roles, like, please let us know. This is very much a grant for the state and the system, and we want to, I think the team that is working closely on this is seeing a lot of opportunity and connections, and I imagine, or I hope that you are as well, and we want to help facilitate those connections and help plug people in where they feel like there's some opportunity for them to get involved. So, and then the last slide is just my contact information. So if you have any questions along the way, or now about the grant, I would be happy to answer them. I appreciate the chance to be able to share a little bit about this grant. It is really exciting for Kansas, and I hope that as a system, we can all just kind of celebrate, like, how much work has been done to get here, and that we've got several ways forward to keep the work going. Kelly, I see your hand up.
Hi, Kelly France Langford. Megan, I just have a question and a comment. My question is, of the 7 million, how much of that will be awarded as subgrants to people around the state? And then just a comment or a plea, when those subgrants come out, it would be great if they were as simple as possible, only because so many of us already have grant applications out the wazoo, and it gets hard to track all of those individual components. But for example, I'm very excited about reimbursement. We spend a lot of money on translation services, which are critical. But access to that particular service is so specialized that the prices are extremely high. So curious about the subgrant amounts and when we could expect to see some of those opportunities come out.
Absolutely. So I'm going to address the translation interpretation. That's actually really, well, it's not great to hear that you're spending a lot. It's great to hear that the need feels on track. And certainly I want to make sure you all are aware of when that rolls out. And I think also we want to know as we go, like, is this working? Is this getting out to families? I think this is certainly not going to fully address language and cultural barriers, but I think it is a really important thing for us to be tracking, like how much of an impact does having some financial resources for that have, and where there are still gaps. So I would definitely appreciate you just kind of keeping that as mind as you go, and letting us know if this feels on track or not. In terms of the subgrants, so there will be a phased approach. Honestly, we don't know. I don't know all the answers to your questions. I think there will be more coming in like early 2025. And so that will include like amounts, eligibility, all of that. So it's definitely coming, but we are still figuring that out. And I hear you on the simplicity, so I appreciate that. That is definitely something that, again, we want to be mindful of people's time as they're filling out, and make it as simple as possible. So I appreciate you saying that. Are there any other questions
or comments?
Megan, this is Maritas. I just want to say thank you to the individuals responsible for writing this grant. I think this is a wonderful accomplishment, as you have said, to our state. It's a lot of resources and impact that it will bring.
Thank you. I appreciate that. Yeah, I will definitely share that with the team that wrote the grant. And yeah, I really, as much as we're super excited to dig in and get going, I think it is also like important to take a beat and like acknowledge this is a big deal for Kansas, and it's really exciting, and like everyone in the system deserves to take a moment to celebrate this. Bronwyn, I saw your hand go up.
I'm trying to figure out how to navigate the audio here. Thank you. This is very exciting. Congratulations. I just have a thought as you were talking about partnerships, to just think about also the research and extension at Kansas State University as a partner in implementation.
Absolutely, I appreciate that. No, and I think there's a lot of work to be done on this grant, and I think, like I said, there's nothing in the grant that's not aligned with the strategic plan as well. So I think we're going to see a lot of overlap and opportunity for people to just be a part of all of this work collectively. So I appreciate that.
I think their expertise in community development will be of great help.
Great, thank you.
Any other questions or comments? If none, Bronwyn, thank you so much for the update. Congratulations on the grant. As Marita said, this is huge for the state. And so you guys have done an amazing job since day one in terms of our strategic plan. And it's great to get the recognition that you've been getting, nationally as well, because, that's something that I think we also are proud of. So, thank you for the updates, and congrats. And however we can be of assistance, please let us know.
Absolutely. Thank you for the time. I appreciate it. And if anybody has questions, feel free to follow up. And Lindsay has very much planted that in my mind of where, if I see opportunities for this group to plug in, we will certainly come back and visit. But if you see them in the meantime, please reach out. But thanks again for the time.
All right, thank you. All right, so we are going to have reports from our work groups. And so hopefully each of you have identified a spokesperson for your work group. And so first we'll hear from whoever's going to be speaking for family-friendly workplaces.
Thank you, Cornelia. Good morning. I'm Dana. I'm co-chair of the Family Friendly Workplace Group with KCSL as a training specialist. This will be a fairly brief update, although I don't know if that's possible for me to be brief, but we met, and I think the first thing we learned in our work, kind of similar to what we did previously, is that there is a lot of this work that already exists. And so maybe our primary goal is to figure out who's doing what and how we can get everybody to the table. But we did talk about we're working towards a recommendation as to what a family-friendly workplace designation would look like, and then a follow-up social media campaign. Those exist, and so we really kind of talked about what are some other models that are out there, not just in Kansas, but but nationally. And so we gathered some information around that and talked through some of that. And then we have, 6 different goals that we're kind of trying to work into that conversation too. But we really, at this point, talked about, criteria for the designation of a family-friendly workplace. Who's going to own that? How do we decide? How do we put in a review process and then push forward on the implementation piece? And that is where we have landed at this point after our first meeting as a group with a couple of new members. So I can answer any questions. That was a really vague update. I get it, but I can certainly answer any questions. If anybody on the team has anything that I missed, which is entirely possible, feel free to chime in, but I'm open for questions.
Questions or comments for Dana or anyone on the Family Friendly Workplace Work Group? If none, Dana, thank you for that update. Next, we will hear from the Exit Interviews Work Group.
Good morning, everybody. This is Stephanie Wiggins. So we talked last month really about our intentions for the group, that our underlying main objective is to create some useful documents to have on hand to be able to utilize across the state for exit interviews. But really that underlying motivation is looking at what factors are prompting our workforce to leave and ideally be able to address that. So some of our goals, statewide workforce insights, really just gaining that clearer understanding and picture of trends in the workforce to help address those retention challenges, data-driven funding. So we're hopeful that being able to have some of this data can help guide decisions in funding in future years at local, state, and federal levels. And then also looking at understanding impact factors across settings. So whether it's individual center-based programs, why their staff are leaving, or family childcare, why they're closing their program doors, what that looks like, and kind of understanding those factors of why those providers are leaving. So currently in that planning phase, looking at addressing a wide range of provider types, like I mentioned, family childcare, center-based leadership support staff, and then exploring avenues for implementing those surveys in ways that work to be able to gather that data across the board in that systemic outlook, looking at maybe involving licensing integration, individual organizations, and other methods. So we're kind of in the phase of looking at existing tools that, like Dana's group, already exists. The no need to start from scratch or reinvent the wheel. So looking at what exists there and then seeing what we can procure from that to be able to develop something, a hard copy of something, and then integrate it within the systems. So if I missed anything, please let me know, group. I'm happy to answer any questions.
If no questions, Stephanie, thank you for providing that update. Next, we will hear from someone who will give an update on the mental health supports work group. Do we have someone identified to speak for them? Okay, if not, then we can hopefully have an update the next meeting from that work group. Can we hear from someone who can give an update on the targeted journey recruitment work group?
Yeah, hi, this is Amy Gottschammer for the group. Is it possible to share 2 slides?
Yes, feel free, Amy. You can take the screen share from me.
Thanks. Okay, so for our first meeting last month, we did a get to know you a little bit since we weren't all familiar with each other, and just kind of tried to identify what brought us each to the table and why we were interested in this particular group, and so that helped us kind of get an idea of what each other's background was. So we tried to come up with some potential goals and areas of focus. That kind of helped identify a couple of goals to with regards to where the compensation piece was. Myself and a couple of others had come from the 6.5.1 group, which did not focus on compensation. So we were hoping to maybe get with some of the people that were and see what data you guys had been able to pull together from last year. Internships and apprenticeships were also another thing that we were hoping to gather information from previous work groups about. We wanted to focus on recruitment of DCF providers and recruitment in general. So if any of the people from prior work groups have information on information gathered, again, just so we're not reinventing the wheel, please get a hold of me. I would appreciate you reaching out. You can send me, I'll put my email in the chat, but it's amy@googlesoflearning.com. And I'd appreciate being able to gather that prior information from you. And then some of our other next steps are, some of the questions we had are just, is there any current data out there that shows how many students are in paid internships, or what paid internships are they, both like secondary, like high school, or higher ed, and where are they available in Kansas? So again, if anybody now or at some point in the near future wants to reach out to me and let me know if you have that information, or if you know how we can get that information, we would be interested in knowing that. Somebody mentioned Taylor Spangler and possibly inviting them to come. So if this person has contact info for Taylor Spangler, that would be great. We'd be looking for that. We also discussed looking into, is it possible, I don't even know from a legal point of view, but this brought up, is it possible to talk to government officials about increasing mill levies to support apprenticeships and internships, not unlike we do in our local communities to support our K through 12 buildings? Is it possible to see about adding, even a broad early childhood increase in mill levies, maybe specifically for internships and apprenticeships, or for early childhood at large in our communities? So somebody that maybe has knowledge of how that part of government works, and is that something that is even legal, and if so, who do we approach for that? So somebody who has that kind of knowledge, if you know that information or know who to talk to, would be, we'd appreciate a lead on that as well. So that's kind of where we are for the moment. Is there any questions I can answer? Okay, I'll stop sharing. Thank you.
Well, thank you. Thank you for the update. Next, we will hear from someone who will talk about system progress communications.
Hi, this is Kelly Franz Langford reporting out for the group. After our September panel meeting, we decided that we would all review the All In for Kansas strategic plan, and then meet again just to make sure that we had a start on some of the systems work that has already begun in Kansas. After that meeting, we came up with some goals. The first one is to make it easier, to align with making it easier for families to access federal and state resources that address basic needs. I think that was 5.1 within the strategic plan. And we decided that we would look at conducting an environmental scan to gather information on what is already out there. So for example, we know there are community navigators, family service coordinators, a lot of family resource centers, a lot of organizations that are already doing some of that family navigation, and starting to try to map out where those are within each community and the differences between each one. We are hoping to meet with someone from 1-800-CHILDREN to look at sort of their lessons learned, what's going well, where their challenges are, if they have any data on how families are accessing their resources, if they feel like this has been successful, that sort of thing, just as sort of a learning point from a system that is designed to be used across the state as far as resource navigation and trying to build off of that. We talked about perhaps collaborating with Family Strong to review their data from their ongoing survey on family needs, and looking again broadly about how families do access information within their community. What steps do families take when they need a resource? Trying to then put those things together in some sort of either resource, a list of the resources or a guide or something. Not we don't want to duplicate what exists. So, but how, if I'm a mom and I live in Auburn, how do I know what I have access to? The next one we wanted to, the next goal from the strategic plan that we were looking to build upon was 3.3, which is establish and implement a statewide quality indicators communication plan that increases transparency, generates more robust data, and supports a greater understanding of priorities and impact. With the target communication audiences being families, providers, state leaders, etc., and really looking at what are the different pathways for communication. So for example, I love early childhood systems work, and I belong to like 6 different listservs, and they all give a little bit of a different take. But wouldn't it be nice if there was just something compiled into one? So we're going to do some brainstorming on that and consider different messaging approaches, and see what we can build out of that. And then we really, for our last goal, wanted to dive deep into, so how do we build childcare partnerships that, or as people are going in, that know all of their resources. So again, this was a challenge that was organically began within our group from somebody that has worked hard to increase childcare opportunities and some of the challenges that she had encountered. And then there were some of us on the call that were kind of like, oh, we have all of these great resources that we've built across the state, but if a person just starting doesn't know where to begin, then we've lost the opportunity to provide that critical support. So how do we look at a comprehensive guide or approach? So for example, to know that Childcare Aware has these resources, KDHE has these resources, DCF has these resources, Go Team has these resources across the state, so that the person that is starting from the ground up really has a roadmap of where to go. So we've got a lot of work ahead of us. I don't know if anybody else from my group would like to comment, or I'm happy to take any questions as well. All right.
Okay, very good, very good. Well, thank you all for the updates. Look forward to hearing about all of the good work and good, interesting conversations and whatnot, and having updates at our next meeting. So next we will have opportunities for you to share bright spots. And so who has information, something exciting and new or interesting information that you'd like to share with the panel? Anybody? Okay, so it sounds like we don't have any bright spots or updates. Marites, were you going to say something, or do we just camera on? No, okay, perfect. Okay. All right. So it's okay. No, it's okay. All right. So start thinking about things that are happening. And so, nothing is too small to share. And so if you have any information that you want us to know about, then we'll kind of hold off till next meeting, and then we'll have lots of things to discuss perhaps. As a reminder, there is a post-meeting survey that Lindsay is going to be sending out following our meeting. So look for an email from Lindsay that will give you an opportunity to provide feedback, so that we can get insight in terms of the meetings and if they're productive, et cetera. For upcoming meetings, we have the CSIT Regional Roundtable, which is on November 12th in Abilene. We have our next Early Child Recommendations panel on November 15th at 9 a.m. And then the next Children's Cabinet and Trust Fund meeting is on December the 6th at 9 a.m. And that is a live stream meeting at the Kansas Children's Cabinet and Trust Fund's YouTube page. We are going to go on ahead and take for simplicity, we'll take a 10-minute break. It is 10:25. So at 10:35, you all will hop back on. You can access the same Zoom link, but they will be breakout rooms for you to then access your work groups. If your work group is meeting now, or if you're having a separate time to meet or whatnot, that's fine. But it will be open for you to meet today, should you be interested in doing that. I hope you all have a wonderful weekend and look forward to seeing you next month. Take care. Bye, everyone.